Good evening and welcome to ISW Council special web series on women's health, Project START, supporting therapy in assisted reproductive therapies, supported by Bharat Serums and Vaccines under its public health initiative. I am Kamal Narayan, your host for the day today. The COVID pandemic has put the spotlight squarely on our health. The arrival of the vaccine and the start of inoculation process has brought hope to millions who want to stay safe and also safely return to their pre-corona days. Yet there are many others who find themselves in despair as their dreams have suffered a setback. I'm talking about those couples who dream about starting a family but are unable to do so because infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to Indian Society of Assisted Reproduction, infertility currently affects 10 out of 14%, 10 to 14% of the Indian population, where scenario is worst in our cities, where 1 out of 6 couple is impacted. On our show today, we will talk about infertility and how we can get on with your journey to beat this. This show is special as we are going to talk about all aspects of infertility and also how IVF treatment can help you. Bharat Serums and Vaccines Project START is an initiative aimed at provide support to couples beyond medicines with initiatives like microfinancing that the treatment and counseling. Project START encourages couples to stay on course for IVF treatment to achieve their goal of parenthood. There may be many questions in your mind on what you should do to succeed in starting your family. You can ask all your questions right here on this platform. We have an eminent expert with us today who is joining us from Mumbai. So let me welcome Dr. Mukesh Agrawal, Director of Aarush IVF and Endoscopy Centre in Mumbai. Dr. Agrawal is a senior IVF specialist with more than 29 years of experience in infertility management with excellent results. He is the founder and director of Aarush IVF Endoscopy Centre in Mumbai. He is a FOXY certified trainer for advanced ART and endoscopy. His special interest in reproductive endocrinology and fertility enhancing endoscopy surgeries have helped him serve and achieve great result for the patients suffering from infertility. Before we start the conversation today, I would request our online viewers to keep sending us their questions in the comment box. This is a golden opportunity to get your questions answered by esteemed and renowned IVF experts like Dr. Agrawal. And we will try to answer as many questions as we can over the next 30 minutes. So thank you, Dr. Agrawal, for joining us on this Saturday.
Thank you very much.
And I'm sure that the knowledge which you are going to share will help a lot of patients and people who are interested to know more about IVF and many other infertility care available.
Sure.
So, Dr. Agrawal, IVF, infertility, and various other ART processes and procedures were available for, couple who are suffering from infertility, and we have a massive number of that. Keeping in mind the large population of our country as well, and many other factors. But the COVID-19, which 18 months of this pandemic, have also brought a lot of those disruptions along with that, which delayed for many these procedures. For many, they could not start because they were having a fear of catching maybe the infection, or the healthcare facilities were not, open for that time. How the things are now, and is it the right time, or people have come back to the procedures? How centers like yours are now serving the couples who, are really, pursuing a very, very critical journey towards parenthood.
Yeah. First of all, good evening, everyone. Thank you, Mr. Kamal and Bharat Serum for this lovely initiative. And you have asked a very pertinent question, because last year when this COVID pandemic started, in India particularly, that was the time all of the IVF centers, we stopped doing the cases, because there was a fear that a patient may catch infection. What will happen to the embryos? And if they are pregnant and infected, what will happen to the lady's health? So gradually from August, September onwards, things started opening up. Vaccine started, vaccine drive started for the healthcare workers, then for the general public. Now, with many of us having taken 2 doses, and the general public also having taken both the doses, and the COVID more or less under control, things are practically back to normal. But still, we have to follow the COVID appropriate behavior in terms of wearing masks, social distancing. So what changes in IVF center we have brought about is like minimize the visits, make it more like a teleconsultation, video consultation, and we pack the injections, and the patients can take the injections at home by themselves, or by their any nearby healthcare workers can give them the injections. Their sonography visits and consultation visits are minimized. So with this, practically we can say that IVF scenario has bounced back to what it was earlier. And patients who are at their extremes of age, who biological age is advanced, ladies who have low AMH, their ovarian reserve is poor, they should not be delaying their treatment. They should come forward to the treatment, so they can conceive earlier with their own biological child.
Thank you, Mr. Agrawal. You have also mentioned important point, because that the age factor, where if somebody and somehow these last 1.5 year kind of has delayed many processes. And interestingly, we have also seen a phenomena where many of the couples who were having some kind of infertility issues could also conceive a child during those lockdown time and all that. But all those who might be delaying planning a family because of multiple reasons, and sometimes it is also possible that they are not aware that they are having some kind of infertility issues, or may face infertility issues. So as you have mentioned that those who are kind of on a biologically advanced age, and there is a window. So what is your kind of advice to them specifically, that if, let's say, they have been trying and they have not been able to conceive, do you think that they should be looking for some more specialized consultation and advice related to infertility care? That might be a reason that is delaying or not. That is why they are not able to conceive a child.
Sure. See, earlier we used to look at only ovulation, whether ovulation is happening or not, whether tubes are open or not, fallopian tubes, how is the uterus, and for the male partner, the semen report. But now there is a concept of ovarian reserve, which is playing a very big role in ability to conceive. So this ovarian reserve is related to the biological age of the woman. And also we can judge it by simple transvaginal sonography by looking at the antral follicle count. By this antral follicle count, we mean which are the follicles present in both the ovaries from the size of 2 millimeter to 9 millimeters. So we count those follicles, and if they are in good number, more than, reasonably, like more than 6 to 7 in each ovary, then we are happy that our ovarian reserve is good. And also we can do a blood test which tells us about the anti-Mullerian hormone. So these 3A, I always tell, like age, AMH, antral follicle count. So if you look at these 3A and you judge the ovarian reserve, so if the woman's ovarian reserve is good, okay, she can try naturally, she can try with IUI. But those who have low ovarian reserve, they should be under specialist care, particularly infertility specialists. And if they have to opt for IVF, they should not hesitate and go for assisted reproduction, earlier the better, so they can conceive their own biological child. And also age is important for the male partner also. We have seen that the male partner, if their age is above 50 years, then there may be some problem with the sperm DNA. There is increased incidence of sperm DNA fragmentation. These men also have poor fertilization ability, and also when they produce offsprings, like their children may have a slightly increased risk of autism and some other disorders. So for the male partner also, age is an important factor.
Yeah, thank you so much, Dr. Agrawal. Dr. Agrawal, many times because of COVID-19, and you are saying that there is a certain age factor involved, and definitely people either naturally or with assisted reproductive technologies available can try to conceive their biological child. But this COVID-19 has also, kind of created another phenomena where many of the people are, delaying or postponing their family planning because of maybe financial uncertainties. COVID-19 has also taken away, kind of livelihood, employment, and other financial securities of many people. Do you think that, have you come across such kind of situation where people are not able to afford for treatments like IVF or infertility care, or are planning or coming to you that can they defer their family planning because they want to be more kind of protected in terms of financially, and they want to get out of this uncertainties which are at different level, these kind of uncertainties still persist?
Yeah, this is very relevant. Now, after this COVID-19, and because of the little bit of financial insecurity, unemployment, and all that chaos that has happened in the financial market, a lot of these patients are having this problem of finance, because usually this IVF assisted reproductive treatment, they are a little bit expensive. So here there is a big role of this. You can say social responsibility of the corporate social responsibility, wherein, as you mentioned, Bharat Serum is doing this, offering this loan without any interest. Similarly, there are other financial institutes, they offer loan without interest. So many times that interest component is absorbed by the main IVF center itself. And like that, we conduct a lot of these camps where we offer concessional treatments. And there is another very important aspect which people have realized about the insurance. So I know that in our country, there is still no medical insurance for the infertility treatment per se. But if people have realized the importance of medical insurance, health insurance, this is very true. So we all have to chip in and help these couples how to get the treatment also, and not delay, particularly if the delay will mean some compromise in the treatment. But those who are young and they cannot take this treatment now, maybe a little bit they can delay till they are financially better off.
So those for whom this window is kind of is closing, if I can say so. You are saying that various support system available. One of that, this project start, but at the same time, I think a lot of corporate CSA, social responsibility programs are also coming up. I think even corporates should look into that, because this should also try to support their employees under some kind of such a scheme where they can help them, kind of plan their family and have a family, because it is directly linked to a healthy mind as well. With
Exactly.
mental health is a very important outcome of and one of the major impact goes on the mental health of the people if somebody is suffering from infertility. Dr. Agrawal, so we talked about for those who are planning their family, and many times they are childless. But we have also seen that many of the people suffer from some kind of secondary infertility. People do have their one child, but they want to have another child, and after a certain gap, they are not able to conceive. What kind of this problem is, and how prevalent it is, and what are the ways to kind of treat that, or is IVF or other ART procedures are the possible help for them?
Yeah, so as we have a commonest infertility problem is the primary infertility problem, wherein they don't have any issue. But secondary infertility is the one where the couple has conceived in the past, and mostly we can say that they already have one living child. Now, these secondary infertility cases are not all that common, but it can definitely happen. Suppose there is a big time delay, then again the age factor will come in. Suppose lady had first delivery by cesarean section, or in between she had some miscarriages, she has undergone dilatation and curettage, some kind of procedure in the uterus, then we should think of some pelvic infection. Is the fallopian tube open or not? So in these cases of secondary infertility, many times we suggest them either sonosalpingography, which is a very less invasive technique by which during sonography we instill saline into the uterus and the fallopian tube and see that it comes in the abdominal cavity, or we can subject them to hysterosalpingography procedure. So these are less invasive procedure rather than going for the laparoscopy, hysteroscopy procedure. So evaluate the tubes, evaluate the ovarian reserve. Again, don't assume that male partner is perfectly normal during secondary infertility. So whenever I give my talk, my first statement, first slide is that it is a couple's problem. So don't keep on investigating only the female partner. Always at least have one semen report of the male partner before you subject any invasive test for the female patient. So look at the semen report, then you judge whether you want to go for simple IUI treatment or go for higher treatment. So the secondary infertility patients usually have a good chance of conceiving again.
Thank you. So you are, kind of making it very, I think, strongly known that do not associate infertility only with women, and it is equally important to look into the male infertility issues as well. Many times this is kind of overlooked, and a lot of stigma and a lot of assumptions are associated with the women only. We are getting some questions from our audience also, and one of the question is that is male infertility becoming more common? And what are its major causes? What is leading to the male infertility, and what are the treatment options available to tackle this challenge as well?
Yeah, see, almost 1/3 cases of infertility, they are due to male partner, and another 1/3 cases are due to combined factor. That means there is a minor problem with the female partner as well as a minor problem with the male partner. But then when they are together as a couple, this problem gets compounded, and then it leads to infertility. So almost you can say that male infertility accounts for almost 2/3 of the cases. So, and as rightly asked by this person, this male infertility cases are slightly on rise. What semen report earlier days when we were students we used to see, nowadays gradually there is a decline in the sperm count, and all the parameters of the semen report have gradually gone down. Maybe this is effect of the environmental pollution, excessive use of pesticides, more of like artificial life that most of us are living, what kind of food we are eating, the stress level, and the timing of all the habits have changed, like from kind of natural, from nature we have moved far away. We have become using a lot of these plastic products and things like that. So all these have impact on the sperm count. The most important when we see a male infertility patient, we have to look at whether it is a treatable cause or it is a non-treatable cause. Suppose it is a varicocele problem or some infection in the seminal reproductive system is there, male reproductive system, then we have to treat those conditions either by medicine, or varicocele can be corrected by surgery. So when we correct the semen parameters, then they have a ability to conceive either naturally or by simple treatment IUI. Those who have a non-correctable problem and their semen report is very poor, they should go for intracytoplasmic sperm injection, that is the ICSI treatment. So most of the male infertility patients can have their own biological child. Even a person with zero sperm count, azoospermia, then we categorize them into two categories, whether it is a obstructive azoospermia or non-obstructive azoospermia. Many times due to hydrocele or some past hernia surgery, or in our country tuberculosis infection, there may be a blockage and then the sperms cannot come out. So those cases also can be treated by taking out sperm from testes and then using it for ICSI treatment. So that's how we can help most of these couples.
So, Dr. Agrawal, you are saying that most of the male infertility patients or those who have this condition can definitely have their biological child. There are treatments available for all the possible situations, but I think what is more important that as for any other health issues, being in your perfect mental and physical health, eating healthy, staying stress free, I think exercising and all that, which is common for in general healthy living, is equally important for having a good fertility. Or
smoking, drinking, those habits they have to give up, when they are trying for pregnancy.
Dr. Agrawal, many times, especially women, and as what is the best age for women and men to have a child?
I think for our Indian scenario, for the woman, it will be anything between 25 to 32 years. I guess 30 to 33 years is the best age when their fertility is at its best and it is easy to conceive. And same holds for men also. Maybe for men, we can take a little liberty up to 40, 45 years of age. But for women, there is a definite window period.
So this, up to 32, 33 years, and in present time, it is the high time when somebody is pursuing the career, and then, I think we are seeing even the late marriages are happening in late 30s. Is it, one of the reason of increasing infertility problem, or how these couples or women can still, kind of preserve their fertility for a later stage, and they can plan family accordingly, because it is very important aspect of life. People have to pursue their career, but people have to look into their financial security, and obviously, as male and female both are equally contributing to the economic growth of the country also. It is important that they continue to do that. So what can be the way for them to preserve their fertility and have a child when they want?
Yeah, so this is a very good question because at the best period of fertility, as you rightly mentioned, that there is a conflict between the career and getting the financial security, and at the same time age is advancing. So for these type of couples, we have the option of either preserving their eggs or if they are married, then we can preserve their embryos. And for the male partner alone, it can be semen cryopreservation. So with the, technically, if I say the vitrification procedure, for last almost 14, 15 years, vitrification procedure of cryopreservation of the female eggs and the human embryos have greatly helped in almost giving a very good success rate. So for this type of couples who want to delay, whether they are married or not married, they can go for cryopreservation of either egg or the sperm or the embryos if they are married. And then they, in future date, they can use it. But one word of caution, I always say that it is not fertility preservation. It is a fertility potential preservation. I mean, they must realize that it is the potential to conceive. And nobody can guarantee by preserving the eggs and the embryos and the sperm. Nobody can guarantee that there is a sure shot that they will conceive in future. So it is always better to go for fresh.
That's very important, I think, to note that this is fertility potential preservation, it is not a guaranteed return kind of investment. But for that matter, it is definitely, I think with the science advancing and having a lot of those technologies available, what are the chances? Is there any percentage of, is there any spectrum or percentage that these are the chances of having a child with this kind of process?
See, first, let us look at the semen cryopreservation. With the semen cryopreservation, the chances are very good because we can ask the male partner to give multiple samples and make a lot of these aliquots and keep it, so that it gives a good backup. Now, for the female partner, if embryo cryopreservation is there, the chances are as good, or let's say even better than the fresh transfer. Nowadays, even in IVF, we are moving towards the all freeze method, where we freeze the embryo and transfer in the subsequent cycle. And with respect to the egg cryopreservation, there is a slight limitation compared to the embryo. For the egg cryopreservation, we need a slightly larger number of the eggs. So sometimes we ask these women to undergo 2 cycles of ovarian stimulation and take out the eggs from both the cycles and then preserve, so that their chances of fertility increases.
What is your kind of recently trend you have seen in your clinic? Your clinic being a reputed clinic in Mumbai, and it being a financial capital, most of the people, I think, are working people. Do you get more of these requests or these cases where semen, cryopreservation or egg or maybe embryo preservation is happening?
See, we are getting recently in last 3-4 years a lot of such requests, and people from abroad are also coming for cryopreservation. And slowly with the corporate employees, this request is increasing. And nowadays, because of the help of the media, a lot of these women have awareness about such treatment modality being available. And also, very important aspect of this cryopreservation, let me touch upon that topic on this platform, that is the cryopreservation for the cancer patients, oncofertility. The cancer patient, before they start chemotherapy, those cases we are also getting many, where they want to preserve their eggs or embryos or the sperm, depending upon the case. So the same applies for the social reason, cryopreservation for any social reason or for the reason of the cancer.
I think that's a very important area, because I think we are also seeing, unfortunately, a lot of cancer cases increasing even in early age, especially kind of breast cancer and all that. I think that's a very important aspect, and I think a great assurance for these women or couple as well, that they can continue to have the possibility of having their child even if they undergo this kind of treatment. There's another interesting question coming in, that is there any way for HIV positive women to get pregnant, and one can can somebody or HIV positive women pass on the infection to the baby? There's a question coming from audience.
See, this HIV positive woman, first of all, we will look at their health issues. Whether this HIV positive status has led to full-fledged disease and their health is compromised, then it may be better that they don't go for conceiving themselves. And otherwise, if this kind of request is there, then in association with the treating physician, we have to understand their immunity level, their HIV infection load, and based on that, then we can suggest whether they should go for IVF treatment. And there is always a slight possibility of transmitting the infection either in the womb or when they are breastfeeding. But with the current medication, that risk is greatly reduced.
Thank you. I think that should address the question for this, for our audience. And also, I think as for any other health issue, it is always better to personally consult a doctor. And because if every body is different, everyone has a different specific requirement, and then your doctor can or expert can help you more. And I'm sure Dr. Agrawal's guidance will also help you in, I think, consulting a right doctor. Thank you so much, Dr. Agrawal, for your time today. We tried to touch upon a few points, and I'm sure that the audience would get benefited out of it. We will continue to get more questions, and we'll share more questions, and we'll try to answer our, to our audience through you at a later stage also. So, with this, I would like to kind of conclude today's program. But if people still have some questions, they can keep sending that to us, and we will get our experts answer them and provide through this, the next program, and also through our chat from where we can receive the questions. And at the same time, you can also send your questions to our WhatsApp chat, which is also available on our WhatsApp, Facebook page. We will be back soon with our next show on women's health. So keep sending us your questions and continue to hear the best advice from the experts in the area of fertility care on this program, Project Start. So thank you so much and goodbye.
Thank you.